Hello and welcome to this new podcast of the American Journal of Public Health. Here we are again for this other podcast with my colleague and co-host, Professor Vickie Mays from UCLA and associate editor at the Journal and on the campus of Washington University in St. Louis. And we took this opportunity to discuss with two students from the school, the Brown School at Washington University, to have a follow-up on a previous podcast that we had done with Barry Levy and Bob Gould about training public health students about issues related to war and what they can do about it. And so we had the perspective of two senior public health persons, with a great experience. We wanted to also have another perspective from more junior persons and who give us also the perspective of the current generation.
We heard from them, and what we want to do is you're the next individuals to teach, to, actually, start to publish in our journals. So we really wanted to hear from you, your thoughts about, okay, in terms of the training that you have, in terms of working in as a public health person responding when there's a war. I've heard people say about choosing one side because the other side is being horrible. I've heard people say, no, you need to be on both sides. Mm-hmm. And then I've heard people say, we shouldn't participate. So I'd love to hear for you to tell us what you think is you want in terms of training going forward, in terms of, we are in the midst of a war, we're going to have others. So what do you think your role is? And, how should we prepare you in terms of the future?
Let's we start with you, Alice. You're a student in the program of global health at the Brown School. So let us know.
Well, thank you so much. And as you're just saying, when I was reviewing the past videos, I was just impressed by how much years they've worked on the field and so much experience, which is something that I'm still to work towards too. And I definitely value the beauty and the opportunity to speak up as the next generation of leaders. And on what you just said, I guess that the most important part of our training, or at least what we hope to see, unfortunately, as you just said, wars are still coming, which is so unfortunate, but the reality. I'm going to say that we need to be trained in a way that does not necessarily mean working in the most effective environment. For instance, when we are talking about designing interventions, how do we design interventions in less than ideal situations and make them be effective, because there are most times we want to serve. As a public health specialist, you really want to serve, but sometimes you are not equipped with the skills that work in less than effective situations, and you can feel so frustrated and sometimes feel like, well, I can't do much. I don't have that. But the fact that we don't have that doesn't mean that we should all kind of give up and wait for it to come, because sometimes it doesn't. And coming from a low-income country, I know that it is important to be trained to do more with less. I'm not sure if that makes sense.
Yeah. Those are great points.
Yeah,
great points.
Yeah. And Masoomeh, you just graduated. You have an MPH, moving to Colorado. Just let us know your perspective on this.
Yes, I want to echo what Alice said. Actually, we should embrace the reality of adversity is going on across the globe, not in one country, in the other country, because we are all connected, and the adverse outcomes of such a thing like war or exposure to war zone area is not isolated to one area in the world. It widespread across the globe, and it impacts all of us. Mm-hmm. no matter where we live. In terms of what is necessary really in educating public health students about the war, I think that it is so essential to train students look at this adversity exposure through transdisciplinary lens. We need to have a lens from different perspectives like sociology, psychology, biology even. Exposure to war zone area has biological impacts. For example, generational inheritance of long-term exposure to chronic stress, and also sociological impact. We need to look at the situation through different lenses and embrace that, accept that, and find a solution to design intervention, as Alice said. We cannot, forget. We cannot keep silent, stay away. And I think that building the capacity that students have the courage to talk about it and listen through, for example, social media to what happened around the world, and then tailor the very appropriate reaction, impartial reaction. It's very important.
Yep.
What are some of the things that we should be teaching in our programs to prepare you? Is it to teach you, like, we say, well, okay, we want to make sure you're in global health so that we can send you there? Or is it really teaching you about, and I like the way Alice put this, about, you're going to have to learn to respond with less than being prepared, because every war we see, we don't know it.
Yep.
It's not the same as
Yeah.
another. So what would you like to see in terms of your training?
Well, I think that, and I'm going to say it because I've already seen part of it here at the Brown School, having not treating the others as the others, having being a global citizen and seeing people from around the globe as really as being a whole, global community. And I think that, first of all, not thinking of them as someone else's problem is something that helps. So designing a curriculum that embraces humanity and kind of gives us or every student an idea of being culturally sensitive, of seeing the person as a person and wanting, because I believe that we can have different biostat class, we can have different AP classes and like courses everywhere, but the way we design them and at least what the students take the most out of, I feel like it is important that it becomes more than just concepts, and we see them as a way to serve everyone and in different contexts. As you're saying, wars are different everywhere. It can be a war. Populations are different. The way they are affected is different. What they need is different. So we cannot afford to just kind of cram some concepts as written in some stones, but being flexible and understanding and kind of finding a way to not changing, but adapting it to where we are. So in the way that we are taught or trained, it is important that we learn concepts, but in a way that we, or in the back of our minds, we know that this will need to be adapted in some context. It's not just this, it being flexible when we have to.
Just in case our listeners don't know,
Okay.
Can you explain a little bit more about what othering is? Because it's a really critical concept these days.
Okay, well, I hope I get it right. And so othering is, and it's something that I personally had to learn, not in the best circumstances, as a person I'm originally from Rwanda, and being here, first of all, when you're there, it's home, and sometimes you can just feel that some discussions can be on the radio, it can be on some journals or articles, and you just see certain groups of people or a continent or a country or gender identity is just being treated as, it's us and it's them. Services for us, and what do we do about them, not wanting to find, all of us, humans. And it's amazing how, at least in the past, some papers really go the extra mile to differentiate groups of people and designing or thinking that this group needs this, but that group not necessarily, So that is one way of seeing the othering as, especially in public health or in any other field.
Thank you.
I hope
So, Massoomeh, I want to go back to this idea of what needs to be taught. And I think Alice explained, and I understood it essentially conceptually, what the course should be about. But how should the course be organized according to you? What should be taught? And should it be lectures? Should people be sent abroad? Should be sent to war zones? I mean, how would you conceive such a course?
Actually, I think that it should be a combination of all methods. I had the privilege of studying in Brown School that is very good at, instructing the courses in a very engaging situation, engaging classes, and all people from any perspectives were so welcome to express, talk. But, only sitting in the classes is not enough, at least for me and people who think like me. I believe that field experience play a very, very important role in learning things. But, I don't want to go very, very far that we should send a student to the war zone. I myself had war zone exposure over my childhood, and when I was very young, at 20, when I was at 20s, and I know that it has sequela and scars, and maybe it's not very practical sending someone to the war zone. But I think that practicing many of those skills here is also very beneficial. For example, I heard that around the campuses in the United States, people tried to talk, to express their concerns, advocate for social justice. And this is a kind of practice for public health practitioners, public health students. And I encourage all authorities to embrace the very challenging situation and understand that when people are practicing things, maybe something not very good happened, maybe things very good came out of this. Recognize the students' rights to practice this here at school and, open the dialogue, a constructive dialogue. I believe that thank you for inviting us here is a kind of opening a dialogue, and this is helpful. People talk, understand each other, and see that we are not threatening to each other. We just want to find a solution. And, public health realm aims to be impartial. So many of us should practice this. It is not very easy to be impartial because we have some shared value, but we have conflict of interest, benefits, and we have such, traumas. Sometimes traumas informed our perspectives, and we should be aware. We should practice to be aware of what is my mental, emotional state now.
I think that in terms of organization of the curriculums, it is important that we have of course, the in-class exposure. And I had an amazing professor this semester, and I was impressed by how we were studying some of the ways of worldviews from different cultures around the world. And that alone, even myself, I was impressed by how much I was learning from other cultures. And So that being one aspect of the class, not necessarily having all the class materials being one-sided or one-viewed. And in terms of global exposure, physical exposure, I'm going to say that it's very important to be outside, serving in different parts. I had in my global health specialization, students go in different parts of the world they work in different areas, providing sanitation in different fields. And I'm amazed by how much we learn, Actually, that is a very good way to prevent the othering, because you see that, we joke, we all laugh, we all go hungry, and you just start to see them as people. And then when the time comes for serving, in terms of conflict or other times, then a person can voluntarily say, these were my friends at some point, or people like these were. So the concept of the other, or not so much my problem, kind of not disappears, but you get to learn and see that these are like technically my brothers, So global exposure is also a good way to normalize and having everyone seeing, the human in you.
Yeah.
And I like very much, the two perspectives, because Masoomeh says we can have a global experience just next door, and it's also important to have it maybe also abroad, because but the same skills actually can be accrued next door or across the
My
the
global
ocean.
exposure has definitely been working here in St. Louis by far.
Okay. That's interesting.
When you say you had your experience here, can you talk a little bit about that?
Yeah, sometimes, at least traditionally, when we say global exposure, people hear serving in low-income countries, or the global south. And again, the Brown School was amazing about this. They're like, sometimes, depending on where you are from, the global exposure, it is different. And mine was here in St. Louis, and I was serving with an organization that works around housing, affordable housing, and affording not access to healthcare, but some of the health benefits and affordable meals. I could not believe how much I learned from that, and how it was an amazing opportunity to serve. So, for instance, in my country, we do not so much struggle with affordable housing, but here it's a real public health issue. And it gave me ground to serve, learn a lot, and as I was saying to my supervisor, learning some transferable skills that can still be adjusted in my community work back home. So, finding a way to learn what can be transferable in either ways. Again, it's the global community, it's everyone.
So when you say learning, you mean the experience enriched you and to become a better public health practitioner in situation of war,
for instance,
and tension,
I'm going to say,
inequities.
Inequities are not the same everywhere, but the effects can be, comparable. And for instance, designing interventions, talking to people with a different perspective, convincing, community works. And all that is something that I learned here. I had some work back home, but my experience definitely grew stronger here. And most importantly, I feel like now I have skills that can help me do the same or not the same community work, but in different communities around the world, which is very important if you ask me, because it's not we do not necessarily have to work in our own countries. Or when I'm training my students in the following, the coming years, I'll be training them to be more than just Rwandans who serve in Rwanda. They'll be able to the transferable skills that can be applicable to different places.
It's incredible the ways in which your insights about how to do this, because it really is an issue of there's a war, but it doesn't mean you need to go there to help that country.
Exactly.
There are people from that country that are here that are being othered, or that, and your abilities to be where you needed to be, but to have a perspective that was outside of where you were. I think that was just incredible. So, one of the things I'm going to hope is that you're going to go on and have students that you will be teaching.
I hope so too.
These lessons that you've been bringing to the forefront, it's like, oh my gosh, I just had one. So, that's just really incredible. I think the way that you're thinking about it. And it makes it doable in the curriculum. Because you aren't coming up with things that, we got to go raise $7,000 for you to go somewhere. And then we've got to do all these things to get you there. But you're really saying how to learn about the other in many different contexts. And that you don't have to be in the conflict to be able to train yourself to be able to respond to a conflict.
Yeah, when the time comes.
Yeah.
Yes.
So I really appreciate, what you've shared with us.
Yeah. Thank you very much. Please.
Sorry, I think there's just to add this to what Alice said. That was that it is the implication of social media that makes the world smaller and smaller.
So true.
And, yeah, exactly. And for now, I know that about 27 conflicts is ongoing around the world that involved armed, violence, and I heard about all of them on social media, and every single of those peoples in the war zone areas is like a friend, like a person. I know them and I care about them. And I think that students should be taught to make coalitions and collaborative health initiatives among the students from different parts of the world, and initiatives that bring people from conflicting parties to address a common health concern and serve that health concerns as a bridge of peace, and it actually opened the stage for trust, for cooperation, for exchanging the skills and knowledge and building capacity across the world. And, one of the good consequences is that when you can build capacity infrastructures across the world, you can prevent immigration, which is a big consequence of war zone areas and this thing.
Yeah, and what you say, public health practitioners are actually agents of peace because we have to understand both sides. We tend to create what you said, the dialogue, etc. And this is, preventing sometimes potential conflict.
Yeah, actually, I will be more than happy if they can add more political sciences, policy making, and exposure to these community of people who are involved in decision making and policy making, not only direct health policy, but also health related policy. Because I think that we have perspective that we can inform them with evidences that we produced firsthand by ourselves, and we can introduce those evidences and help them to make policies that informed by those evidence.
Alice, Massoomeh, we've reached the end of this podcast, and thank you very much. This was enlightening and so warm. The message that you transmit is, I feel inspired by you, and thank you for that.
Thank you for the opportunity.
Yes, thank you for opening this dialogue, give us that opportunity that we speak from what we heard from our peers, other students over the campus.